Hello, I'm Dr. Joseph Butler. I've spent decades caring for older adults, listening to their concerns, following their progress, and, most importantly, watching patterns emerge that most people never talk about. Today, I want to discuss a problem that affects nearly every senior I see in my practice. A problem so common that many people believe it is simply a normal part of aging. A problem so quiet that it often goes unnoticed until real damage has already been done. 95% of seniors experience it in some form, and most don't even know they have it. This problem doesn't announce itself loudly. It doesn't always cause sharp pain. It doesn't send you to the emergency room. Instead, it creeps in slowly. It hides behind words like, just getting older, slowing down, or that's normal at my age. But it is not harmless. What I am talking about is chronic low-grade inflammation combined with age-related nerve and tissue sensitivity. A silent process that gradually damages nerves, muscles, blood vessels, and even the brain after the age of 60. Let me explain why this matters so much. As we age, our immune system changes. This is well documented in medical literature and is known as immunosenescence. The immune system becomes less efficient at fighting real threats, yet paradoxically more likely to stay mildly activated all the time. Instead of short, targeted inflammatory responses that heal and resolve, many seniors develop persistent, low-level inflammation that never fully shuts off. This chronic inflammation doesn't usually cause fever or obvious illness. Instead, it quietly interferes with normal body function. It affects nerve endings, especially in the hands and feet. It disrupts blood flow to small vessels. It damages the protective myelin sheath around nerves. It interferes with insulin signaling, muscle repair, sleep cycles, and even memory formation. In my clinic, seniors rarely come in saying, "Doctor, I think I have chronic inflammation." What they say instead is, "My feet feel numb at night. I get tingling in my hands. I feel weak when I stand up. I'm tired even after sleeping. I've lost my balance a few times. My memory just isn't what it used to be." Most assume these changes are inevitable. They are not. Medical research clearly shows that chronic inflammation is one of the strongest predictors of declining mobility, frailty, falls, cognitive decline, and loss of independence in older adults. In fact, elevated inflammatory markers like C-reactive protein and interleukin-6 are consistently associated with worse outcomes in aging populations. But here's the part that surprises most of my patients. You can have significant inflammation and nerve irritation without abnormal routine blood tests. You can look fine on paper while damage continues silently. That's why so many seniors don't know what's happening. Let's talk about how this problem actually feels in daily life. For many people, it begins with subtle sensory changes, a mild tingling in the feet, occasional burning sensations, a feeling like socks are bunched up under the toes when they aren't, hands that fall asleep more easily, a slight loss of precision when buttoning a shirt or picking up small objects. At first, these symptoms come and go. They may only appear at night or when sitting still. Over time, they become more persistent. This is not simply bad circulation or old nerves. This is inflammation-driven nerve dysfunction. As inflammation irritates nerve endings, signals become distorted. Sensation dulls in some areas while becoming hypersensitive in others. Balance suffers because the brain receives poorer feedback from the feet. Muscles fatigue faster because nerve signaling becomes inefficient. This is one reason falls become so common after 65. It's not just weak muscles. It's poor communication between the nerves and the brain. Now let's talk about the brain. Chronic inflammation does not stay confined to the body. Inflammatory molecules can cross the blood-brain barrier, especially as that barrier becomes more permeable with age. Once inside the brain, they interfere with neurotransmitter balance, synaptic plasticity, and memory consolidation. This is why seniors with higher inflammatory levels are more likely to experience brain fog, slower thinking, mood changes, and memory lapses. Not dementia, not Alzheimer's, but a level of cognitive decline that makes daily life harder and more frustrating. And here's the dangerous part. Inflammation feeds on itself. Poor sleep increases inflammation. Inflammation disrupts sleep. Sedentary behavior increases inflammation. Inflammation makes movement harder. Poor diet increases inflammation. Inflammation increases insulin resistance and fatigue. This vicious cycle is why the problem worsens quietly over time. So what causes this process to accelerate after 60? Several factors converge. First, muscle mass naturally declines with age if it isn't actively maintained. Muscle tissue plays a major role in regulating inflammation. Less muscle means less metabolic protection. Second, blood vessels stiffen over time. Reduced circulation means slower removal of inflammatory byproducts. Third, many seniors unknowingly consume diets that promote inflammation. Highly processed carbohydrates, refined sugars, excessive omega-6 fats, and low fiber intake all contribute. Breakfast foods marketed as healthy are often the worst offenders. Fourth, medication burden matters. Many common medications used by seniors can worsen inflammation or nerve sensitivity as a side effect, especially when combined. Fifth, inactivity becomes more common, often due to fear of injury or fatigue. But this only accelerates the problem. None of this means aging is a mistake. It means aging requires different strategies. The good news, and this is the part I always emphasize, is that chronic inflammation is modifiable. You cannot stop time, but you can slow this process dramatically. The first step is awareness. When seniors understand that numbness, tingling, fatigue, and balance issues are not just age, they stop ignoring the warning signs. The second step is targeted lifestyle intervention. Medical evidence consistently shows that gentle, regular movement reduces inflammatory markers more effectively than medication alone. Walking, resistance exercises, balance training, and even chair-based strength work improve nerve signaling and muscle metabolism. Nutrition is equally powerful. Diets rich in whole foods, adequate protein, fiber, antioxidants, and anti-inflammatory compounds support nerve health and vascular function. Even small changes can significantly lower inflammation within weeks. Sleep is non-negotiable. Fragmented sleep dramatically increases inflammatory cytokines. Improving sleep hygiene often reduces symptoms patients thought were irreversible. Stress management matters more after 60 than at any other time. Chronic psychological stress directly fuels inflammation and worsens nerve sensitivity. And finally, medication review is essential. Many seniors are taking drugs that were appropriate years ago, but may now be contributing to fatigue, nerve irritation, or metabolic dysfunction. A careful review with a physician can make a remarkable difference. I want to be very clear. This is not about chasing supplements or miracle cures. It's not about fear. It's about understanding the body you live in now. When seniors address inflammation early, they maintain mobility longer. They reduce fall risk. They protect cognitive function. They preserve independence. And perhaps most importantly, they stop blaming themselves for symptoms that were never their fault. If you're over 60 and you recognize even a few of the signs I've described, I encourage you not to dismiss them. Pay attention. Ask questions. Advocate for your health. Because while 95% of seniors experience this problem, the outcomes are not the same for everyone. Those who understand it early do far better. Those who ignore it often don't realize what is happening until it has already taken something important from their life. My goal, as a geriatrician, is not simply to add years to life, but life to years. And that starts with recognizing the silent problems before they become loud ones. If this message helped you understand your body a little better, I invite you to stay connected. Subscribe to the channel, join our community, and continue learning how to age with strength, clarity, and dignity. I'll see you in the next video.
Join us on Healthcare Seniors.
Be part of our community and watch the next video.